So today we're going to show how we're going to infuse some sodium chloride into this patient who has an antecubital IV line already in place. So the first thing that we're going to do is we already reviewed the orders on our computer, on our electronic medical record. So the next thing that we're going to do now is go into the patient's room and identify the patient, explain what we're going to do. So I'm going to knock on the door. And it's Mrs. Smith. I'm going to say, good morning, Mrs. Smith. And I'm going to say who I am. I'm your nurse. I'm Lisa. And I'm going to just be checking your name band and tell you what we're going to be doing today. So I'm going to check her name band. And I see that the name is correct. She told me her name is Mrs. Smith and her date of birth. And so I see that she has an IV line here, but I'm not going to touch it yet. So the first thing I'm going to do is just tell her what we're going to do. That the doctor ordered some sodium chloride for her at 125 milliliters per hour, and it's a 500 milliliter bag with a GTT tubing of 10. And so we're going to get that going for her. And first thing that we're going to do is raise up the bed for body mechanics. And I'm going to wash my hands. I'm going to lower down one of the side rails so I can get closer to her. Okay, I'm going to use hand sanitizer. I'm going to wash my hands. And then I'm going to look at my supplies here and get started. So I have my all my supplies that I need. The first thing that I'm going to do is go ahead and prime my tubing here. So I have my gloves. Okay, so I have the correct type of tubing here. I have verified that this is the right solution that the doctor ordered 3 times verbally, and I verified it with the computer. We verified who she was. So what we're going to do is prime the tubing. So in order to do that, we're going to take off this cap right here. Okay, take off this cap, and we're going to put that in here. Twist it in there. Okay, and then you're going to open the roller clamp, make sure that's open, and make sure that the fluid is flowing down. And this is enough in here to make sure that the whole tubing is primed, there's no air bubbles in it, and it's ready to go. So I'm just going to take a look and make sure I follow it, make sure all the air bubbles are out first. And this is a clean surface that we cleaned up with some sanitizing cleanser before we even got started. Okay, so now that I see that it's all primed the whole way through, I can close my roller clamp. Okay, so the next thing I'm going to do is I'm going to take this cap off. Okay, we're going to take it out from here, from our priming bag, and now we can put it into here. I'm going to hang this up on our IV pole. See if that will hook up here. Hopefully that stays. Okay, and we've already assessed the IV site. We made sure it's not red or warm or swollen. She has no pain at the site. And we took a syringe here. I'll wipe this with alcohol. We flushed it, made sure it's flushing fine with no pain or any obvious problems. And then we're going to wipe it again with some alcohol. Okay, going to wipe it again with some alcohol. And then we're going to take this end of the tubing. We're going to open the roller clamp like that. Make sure it's flowing. Well, first, actually, we're not going to open the roller clamp. We're going to make sure that we attach it onto her because we've already cleaned it. So once it's attached onto the patient, then we can open the roller clamp and squeeze the tubing, make sure it's coming out. And either we're going to use our watch, or we're going to have a pump and make sure that it's 125 milliliters per hour, and that we've already, you know, set this appropriately to flow at the right rate that the doctor ordered. At the end of the procedure, we're going to ask the patient how she feels, ask if, you know, she has any pain or anything like that, and then if she's all set, we can just come back and check on her and do our documentation. So I'm going to take these off and throw those out. I'm going to wash my hands again, and that should be the end of the procedure, and that's it.